Hi everybody, welcome again to another edition of Ad Hoc with the Doc. We're coming to you live, but not on a Friday afternoon today. Instead, it's a Thursday evening because we have a very special edition. We're here at Naturopathic Specialists, and Dr. Amy Waite and myself, Dr. Dan Rubin, are going to talk a little bit about prolotherapy. And Dr. Waite, if you could, what is prolotherapy?
So prolotherapy, the word prolo comes from the word proliferation. It's a proliferative injection treatment that regenerates joints, tendons, and ligaments.
But why do they need to be regenerated?
Tendons and ligaments don't have a good blood supply. That's why when, let's say, you sprain your ankle, you always have issues with that ankle. They don't have a good blood supply. They don't get those healing blood cells to the area like other parts of our body can.
They can't take the waste material away as well. Is that all regular connective tissue, or is that just tendons and ligaments? What about like cartilage?
Cartilage too. Cartilage, tendons, ligaments, all of the connective tissue doesn't have as good of a blood supply as, say, muscle tissue.
So muscles connect to bones via tendons,
Mm-hmm.
and bones connect to other bones via
ligaments.
Right?
Mm-hmm.
And so if you have like a healthy muscle but a not healthy tendon, doesn't sound like it's a healthy joint.
Right. And you can get minor tears in tendons and ligaments that will cause chronic pain that will show up on an MRI. I get a lot of patients that come in and say, I have chronic pain in my, let's say, shoulder, and they'll say, I've had MRIs, nothing's showing up. So little, even minor tears can create chronic pain. Also, ligament laxity can create chronic pain. So anytime you have ligament laxity, you get joint instability. So if, let's say,
go over that again.
Yeah.
Say that one again.
Ligament laxity creates joint instability. Any instability creates pain.
Well.
Mm-hmm. So let's talk about the knee. So you have ligaments that go around each side of your knee. They're kind of like rubber bands that hold that knee stable. If those ligaments, have issues, if any of these ligaments have been stretched, let's say from any type of injury, if they've been stretched, you get ligament laxity. That creates joint instability. When that joint is unstable, you'll have chronic pain in the joint.
That's a large joint of the body. It's very weight bearing.
Right. So I do a lot of knee treatments, prolotherapy.
So these are ligaments because they're connecting a bone to a bone.
Mm-hmm.
So if this particular one, which looks like it might be the medial, this is the lateral collateral.
LCL.
Okay.
Mm-hmm.
So what happens if this one, the lateral collateral ligament, becomes lax and it's not tight enough?
You will have chronic pain along the lateral side of your
on the outside
leg.
of the knee.
And usually patients will pinpoint exactly whether it's ligament laxity. They'll have pain throughout the whole joint because it'll be unstable. But usually patients will pinpoint the attachment point specifically of these ligaments, and they'll say, I have pain right there. That's where a lot of the minor tears are created, just through day-to-day weight bearing, whatever. A lot of sports do it, but it creates minor little tears in these ligaments, and that creates chronic pain as well.
So you have a connective tissue with poor blood supply that has tears in it.
Mm-hmm.
And so in order to repair those tears, prolotherapy is given because it proliferates tissue.
Yes.
So it helps you grow new tissue.
Yes. So what prolotherapy is it's injecting a solution that causes inflammation. Inflammation becomes a scary word to patients because they think, I don't want inflammation in my knee. But inflammation is actually a good thing. Inflammation is the blood cells getting to the area to try and heal it. That's where steroids come in. A lot of patients will say, well, I've had steroid shots in my knee. They'll work for a period of time, but then it never lasts. And there's a lot of studies saying it's actually damaging to the joint long term. Steroids pull the blood
could be
away.
Damaging to the joint and the bone.
Yes.
I remember that you can get sort of like osteoporosis with long-term steroids.
Mm-hmm.
So the more steroid injections somebody has to reduce inflammation in a sore joint, potentially it could do damage.
More damage that's usually
So
done.
a solution could be prolotherapy.
Because steroids are actually doing the exact opposite of what prolotherapy is doing. It's pulling the inflammation away from the joint, pulling those blood cells, even decreasing, the blood supply, more to the joint, because it's taking away the pain, but it's going to cause damage long term.
Do you see people that have had steroid injections in their knees or perhaps their shoulders? I was going to ask.
I do.
This is a shoulder, correct?
Uh-huh.
Some way it goes.
Yep.
This looks like this
Yes.
is the collarbone. Something like that. Tell us about a sore shoulder.
So, a lot of patients will have. I would say the most common thing I see is impingement syndrome. So you have a lot of tendons and ligaments. No, it's actually very painful. You have a lot of tendons and ligaments that exit underneath the acromion here. You can see how a lot of these tendons are exiting underneath here. If you have any injury to this area, those tendons are going to become inflamed.
That's right here?
Right in here. They become inflamed and you get swelling there. It's almost like carpal tunnel syndrome in the wrist. You get swelling in that confined space. And then you get the impingement syndrome. It compresses the whole area, can cause numbness, pain down the whole arm. I see probably that most frequently. A lot of athletes get impingement syndrome.
And somebody may then go to a physician and get a prescription for an injected steroid into that area. They have symptomatic relief. For how long, generally?
Symptomatic relief I usually see for about 3 to 6 months.
Okay.
But then it comes back, and it comes back with a vengeance. They still have the damage. It's not healing. And it's further decreasing any potential healing that would have occurred because it's pulling the blood supply away from the area.
So how does prolotherapy differ then from steroid injections? Because they both reduce symptoms. Steroids, you say, reduce symptoms, but they mask a problem. They don't cause healing. Proliferative therapy seeks to heal the issue.
So prolotherapy, let's say you cut your arm. What happens? The body sends out signals to cells to come and heal and repair the area. That's what prolotherapy does. So there's multiple ways that it does that. I'm using my needle to kind of damage the area as I'm going into the joint. I'm using my needle to damage the area. Just the needle alone sends out signals to the body to say, come and heal this area. I also inject something called PRP, or platelet-rich plasma, that contains growth factors that also send out cytokines or signals to other cells to say, come and repair me.
Can I ask you, where do you get the PRP from?
So the PRP is extracted from the patient's own blood. So I will be doing a demonstration tonight where I will be drawing a patient's blood. I will extract the PRP out of the blood. Blood normally contains about 6% platelets. I'm going to be concentrating the platelets and in my PRP injection solution to about 96%. So I'm really concentrating those growth factors and injecting it right into the area where they have the pain.
So platelets generally are known to go to sites of a bleed in the body and block the bleed, kind of clog it up so it stops. And it just so happens that platelets have a lot of growth factors in them that they can deliver and deposit right in that local area to help heal whatever wound they're trafficked to. So is that the reason that you're using platelets as your sort of facility to get these growth factors?
Yes, because of the ability to
so you're putting
recruit.
It right there.
Yes, I'm putting it right there. And it's recruiting healing blood cells to come to the area and provide that blood supply that normally wouldn't be there to heal the area.
The platelet's only route of getting there otherwise is the blood vessel. So if you have a poor blood supply, the platelets can't get there to deliver their growth factor.
Exactly.
Platelet-rich plasma. So that's one of the components of prolotherapy, is platelet-rich plasma derived from the patient's own blood. So this is absolutely a prescription-only medical treatment.
Yes.
Okay. This isn't something that somebody can go down the way and get outside of a prescription.
No.
It has to be, okay. Is there any other ingredients in prolotherapy?
So prolotherapy, I personally utilize three different ingredients. Prolotherapy typically is a dextrose or sugar water solution that causes inflammation. So you get inflammation with just the dextrose solution. Then I add something called ozone. Ozone is an unstable molecule that releases oxygen, helps oxygenate the area to further the repair process. And then the third thing I add is PRP, platelet-rich plasma.
And so the dextrose, which is a form of sugar, does that For people who are worried about sugar, this isn't like a lot of sugar.
No.
You're not like giving people sugar; they don't have to eat sugar. This is just to feed the growth of cells.
It's just to recruit, inflammation, get the kind of irritate the solution. It's a very small amount of sugar, and it's not necessarily getting into the bloodstream. It's just into that area, into the joint.
Have you ever had patients that have been asked to have surgery for a joint that's inflamed, and then they've opted for something like prolotherapy and have not needed the surgery anymore?
I've had that happen often. So I'll have patients come in and say, my doctor told me I need a joint replacement. I've also had patients with joint replacements still have pain because the joint is still unstable. Those
right.
The MCL, LCL are still, if they had ligament laxity or whatever, you still have the instability there, even with the titanium, the fake knee. So they're still having pain here, and here, even with the fake joint. So they're still getting that instability and pain. But yes, once I stabilize those tendons and ligaments, people also have meniscus tears. I can sneak my needle right into that meniscus area and kind of pepper that area with my needle, stimulate inflammation, and the body heals it.
Wait, this blue thing is a meniscus? What's the purpose of a meniscus?
It kind of lubricates, so that you've heard of probably bone on bone.
Oh.
That's when the meniscus is worn out. You need that kind of cushion, that little pillow in there to prevent the bones from hitting each other.
So this is me using my meniscus, jumping up and down.
Yeah, you wouldn't be able to do that without a meniscus.
Because that would be bone on bone.
Right.
And PRP can help people who have bone on bone symptomatology.
The body's cells can be recruited to heal up just about anything in and around a joint.
Well,
the body's pretty amazing. It's not necessarily the prolotherapy. It's the prolotherapy triggering the body to come and heal it.
So what I'm hearing you saying is that there are sometimes when steroids are needed, but steroids don't heal. They mask symptoms and can even in the long term make a symptom worse. They don't heal. PRP or prolotherapy or prolozone or the treatments that you're talking about do just the opposite. They can work in concert. Can they work in concert with steroids?
No.
Okay, so this is a big. What if somebody just got a steroid injection?
They are not eligible for prolotherapy for about 6 to 8 weeks after a steroid injection.
Okay. So that's a really
won't work.
Point too. So anybody who's seeking prolotherapy must let their physician who's doing the prolotherapy know that whether or not they've gotten a steroid injection.
Right. Or taking it orally, it won't work either.
Well, I think this sounds wonderful. I can't wait to see. For any other things we want to tell our audience? Are we ready to go?
I think we're ready to go.
So for the audience out there, this is the end of the ad hoc with the doc portion. We are having an in-clinic presentation, so we have an audience here. We're going to stop this particular camera, but please stay tuned to our website because this procedure, as well as other prolotherapy procedures that Dr. Waite has performed, will be available on our website within the week. Today, you're going to be doing which joint?
A shoulder.
A shoulder.
Mm-hmm.
And you have done in the past on video
I've done a knee and an ankle.
Knee and an ankle. So, wonderful. We'll see you out there.